So here's Kermit giving interesting news from the doctor. There's something going on he didn't know about.
Is he a proctologist?
I hope not. And then here's the Popeye syndrome.
Wait.
Caused by doing too many wrist curls, overindulging in spinach, excuse me. Okay, so now he's calling everybody in, all the interns, to see, come in if you want to look at, to see a case of Popeye syndrome. All right, so then like usual, we're going to go over the anatomy, the bones, the ligaments, all that stuff. So there's a lot of intricate details of the hand and wrist that are beyond the scope of what we're really going to get into. I mean, there's obviously hand specialists, hand surgeons, things like that. Because obviously the hands are something important that you're going to use a lot, right? All right, so again, we talked about the bones. We get the radius and the ulna. And then the inert tissue. All right, you've seen all these bones before. I mean, yeah, you should know all the different names of them. I'm not going to list them all right now. There's some different mnemonics. They're in your notes as far as how to remember them. Okay. And then metacarpals, that's basically what makes up the palm, right? We talked about that. And then the joints. At the ulnar carpal, you have the triangular fibrocartilage complex. Now, when we talked about motion at the elbow, and we talked about pronation and supination, which is the bone that rotates at the elbow? One of them stays more stationary and one of them rotates. Okay? So then obviously if it's that way here, how's it going to be on the other end? Which is the one that's going to rotate? Which one is going to stay more stable? Yeah, the ulna. Okay. So it's like the ulna kind of moves around it. So if you feel on the styloid process of the ulna and you rotate your wrist, you can feel that that joint moves. And then the radius. And that's the one that rotates. It actually kind of more stable in its position, but it rotates in relation to everything else because the radius and the carpals move together as one and they rotate around the radius. So they're moving around the radius. So this is the one where the rotation occurs between the distal ulna and the carpals. Then that's where that disc is. And it's going to become significant when you talk about this triangular fibrocartilage complex because when somebody's they're doing a lot of turning motions like this, especially if they're ulnar deviating, that's going to put compression and irritation on the distal ulnar carpal joint. Okay. So this is probably more information than you really need to know about that, but it's there if you want to skim over it. Basically what you want to understand is that it's a complex. It has to do with the disc that's in there, and then also some of the ligaments that support that joint. So if you have an injury to that area, you're going to get some degeneration in that disc, possibly, and then you could have some laxity because the ligaments can get loosened up. Right, so then we talk about the joints at the wrist. You can see that the majority of the articulation is between the radius and the carpals. Right? So basically, for all intents and purposes, the wrist is mainly the radial carpal joint. And then you do have the ulnar carpal joint. And then you have the proximal row of the carpals and then the distal row. I hear a lot of page flipping. Does everybody find the right page for the...
No, because the wrist is the 89, 90.
Yeah, let me...
The carpal is 89 and the thing is 90, so that's why people can't find it.
the very top of 90, like, this is on the, this is, where it says wrist is on page 89 at the bottom, and then this is page 90 right there. So you have proximal intercarpal and distal intercarpal. And so then for the hand and fingers, these are the ones we talked about here, right? Carpal, metacarpal, metacarpal phalangeal, then interphalangeal, you have PIPs and DIPs. All right, so then now at the wrist, you have flexion and extension. So this, and then what kind of deviation is this? And then on the thumb is where you have that, it's a saddle joint, because you can, the surface of the joint, it has interlocking parts. Well, it's like one of them's like the saddle on a horse, right? And then the other one fits like that. So you can move this way and that way. So your thumb, that's what makes us different than other animals, is we got the opposing thumb, right? Because these fingers just go back and forth more or less in one plane, but the thumb can go this way and that way and across like that, so that we can grasp it. So that's where it has that saddle joint where it can go in two different, it's a multi-axial joint. Whereas the fingers, you can do a little bit of circumduction, but it's more so at the thumb. All right, so then basically, again, if this is anatomical position, you can have flexion, extension, adduction, abduction, and then here we have a new one, we have opposition. The opposition, like I said before, is movement towards the fingertips, or gripping like this. And then in this, the other fingers from 2 to 5, you just primarily have flexion, extension. Again, you do have a little bit of abduction, adduction. So actually, you can add that into the notes on 2 to 5. You do have some abduction, adduction.